is a CT scan that we do without contrast. And it measures the calcium that's deposited in your coronary arteries. And it's a quick test, relatively fast, only relatively 5 to 10 minutes, start to finish. And it doesn't require any IV dye, so there's no need for an IV, peripheral IV to be placed. Cardiologists or primary care physicians typically send requisition for a calcium score on a patient who, has low to intermediate risk for coronary artery disease, but they want to stratify and see how the patient, as far as their coronaries, how they look. If the patient has, for example, a history of tobacco use, they're smokers, they have high blood pressure, or perhaps if they've had a family history of heart disease, and they just want to look to see if there's any evidence of atherosclerosis or calcium deposits in the coronary arteries, they will send the patient to us, and we give them the score. Basically, the calcium score measures, in a nutshell, it's going to measure the density of the calcium and the area of the calcium that's deposited in the coronary arteries. The score in of itself is compared, you get your score and then you compare that score with other people of your age, your race, and ethnicity. And that will determine whether or not you're, within a normal range. One of my good friends from college called me and she said, my husband, he went to get his physical exam and the doctor suggested, that he get a calcium score just because his dad had heart disease and he had, a heart attack at a young age. And I said, oh, that's interesting. She said, well, you'll never believe it came back super high. His calcium score was over 500. And so she called me very nervous and concerned because she said, well, my husband doesn't have any symptoms. He's very, active. He does all sorts of exercise and he's never complained of chest pain. So what should we do now? And I said, well, that's the thing about calcium scores. It's like, it's for patients like your husband who don't really have symptoms, but it's a great measure for risk of potential cardiac events. So even though right now he doesn't have symptoms, the fact that he has a high calcium score puts him at a higher risk compared to other men his age and his race. So from that test, we then went on and did a coronary CT angiogram, and they found a very high-grade lesion in his left anterior descending coronary artery, and he ended up having a stent placed. So what percent, this is like one of these cases where it would have been something hidden, nobody would have known until he presented with a heart attack. And I think this was a great example of the power of a calcium score, and basically, directing management of a patient. So I think it's a very powerful tool. It is affordable, and I think given, again, like the significant information you get from a very, pretty simple test, I think it's well worth it. So the test itself ranges in price. Here in Riz, we have the test for about $50 cash. Depending on the insurance that you have, some plans will actually cover the test 100%. And we're so happy to see that more and more insurance carriers are getting on board and realizing the power of this test. So you have to check with your insurance company and see if it's covered. But all they have to do is essentially when they go to their physical exam, their annual physical exam, they can request for this exam to be ordered, and this order comes to us and we just schedule the patient. Calcium score is a wonderful exam for diagnosing, or at least recognizing, the presence of atherosclerotic disease in patients. And it's a quick exam which is very powerful because it guides management.